Hi, my name is Shannon Estemacher. The subject I'm going to be going over for you today is foster care. I have 3 points that I want to go over with you. Now, my purpose statements for this is to inform my audience about 3 things that every foster parent will go through. The first thing I will be discussing with you is daily care, daily reimbursements. The second subject that I will be discussing with you is medically fragile children and what you need to go through in a day. The third subject I will be going through is doctor visits, parent visits, and everything else that you need to go through. Now, 3 sources that I used in this presentation. I looked over 51 useful aging of the foster care, federal and state reporting systems, and foster care altogether. With my first point, we go over daily care. Now, with daily care, the difference between regular parents and foster parents is when we have medications for our children and everything, we don't lock it up. At least I know I don't. So with foster parents, you have to make sure that it's all locked up, it's in a med box, and it's away from other children in the household. You will have DHS workers that come through the household, make sure everything's right. If you have guns, they have to be secured in a lockbox, and then that lockbox needs to be into a safe. Another thing is when you have your bed for your child that you are looking over, you have to make sure that it has everything up to date. You have to make sure that it has no blankets, nothing in the crib. Even if you just say you put a toy or something in the crib, that needs to be out before the DHS worker because that is not allowed with foster care children. You have to make sure that they have a safe place to sleep, to make sure that they're sleeping on their bed, which is kind of difficult with some medically fragile children, but you have to do it according to state regulations. Another thing is clothing expenses, travel expenses. All that is in the stipend that you get, which is the daily care, the daily rate that they think each child is worth. Now, with medically fragile children, they have 1, 2, 3, 4 steps. So it goes by each acuity that each child has. So if they have like a G-tube or any of those little things, they would probably be at like a level 1 or level 2. Now, if they're starting to need oxygen, they have a trach, which a lot of medically fragile children do because a lot of the foster care children that we have are medically fragile. So you have lots of times you have nursing that comes in and everything like that you have to deal with and have to have in your household, which is another set of eyes to help you. With transportation, that's all in your stipend. So your food, your allowance, all that is calculated into a rate that each child has. Now with our foster care, the first bullet I'm going to go over is foster care. Now 7% is underneath the infant. 8.5 years is the regular. So what you need to know about this information is just basically it's telling about the average child that is in foster care. Most of the infants that are in foster care are medically fragile, which goes into my second bullet point. Medically fragile children and what you need to go through. Now, when you're going through medically fragile children, you go down and lots of times you get training. Most foster care parents don't know how to deal with trachs, deal with G-tubes, deal with all those different things that a lot of children that come out have. Now, when your child's on a trach, you need to go down. Lots of times in Michigan, they are dismissed from either Children's Hospital down in Detroit or U of M. Now, with U of M and Children's Hospital, the foster parent is required to go down there, get training. Now, that means you need to learn how to change the trach ties. You need to learn how to suction because that's very important. You need to learn how to put the trach in, take the trach out. You need to look for all signs and symptoms of respiratory distress. Now, these are all little things that you need to learn when you're dealing with a medically fragile child. Also, if you have a G tube, you need to learn how to take it in, take it out, measure, make sure that it has the right water in it, make sure that it has no infection, meaning no smell to it, no drainage, any of those things. You need to learn how to put medication in through it, because a lot of times with these medically fragile children, you don't get 24-hour care and nursing care. So a lot of this times you need to learn how to do all this information from the little 5, 6, 7 hour information that U of M or Children's give you. So you need to study, you need to learn, you need to get a lot of resources from the internet, you need to get a lot of resources from other moms that are dealing with foster children in the society. So when you're dealing with medically fragile children, lots of times, in particular in a case that I'm working, they just kind of get thrown into it, which is difficult. So the particular patient I'm taking care of, she got about 10 hours of training, and that was broken up between 2 days. The child was sent home. They were told about something totally different about it. They didn't get nursing care because it was very hard to staff that nurse right out of the fact. So the parents are just kind of thrown into it. Then when the nurse comes in, lots of the times you think, oh, the nurse knows everything. It's not exactly. Now that child's in your care, so you have to double check, make sure that that nurse knows exactly what she's doing. You have to make sure, or he's doing. You have to make sure that they know how to do all the trach care. You have to make sure that they're doing it right. You have to make sure that they're suctioning. You have to make sure all of that. If you have any information that you need to ask the nurse at that time, and be comfortable with it. And then that's an extra person that's going to be in your house. Lots of times, average children get about 4 to 12 hours of nursing care a day. Now that goes on the acuity. Typically, when you have a trach, most of the parents, the medically fragile children that come home and the foster parents that have to take care of it, get about 8 hours a day of average. So the other 16 hours of the day, you need to take care of that patient yourself. So you have to understand what you're going in through, and it takes a lot of hard work and dedication, which comes into our third bullet point: doctor visits, parent visits, all that. Now, when you have a medically fragile child in foster care, lots of times you have to deal with doctor visits, a lot of doctor visits, which all of that is in your daily care and your daily reimbursement they put in. Your travel expenses, all that. If you're going to doctor visits and everything like that, it's not covered by the state of Michigan. It's part of your stipend that you get. If you're going to parent visits, which lots of times foster care people don't tell you, oh, you have a couple parent visits. Lots of times that's true, lots of times that's not. With medically fragile children, the thing that hinders and helps is that sometimes your visits are put off, but lots of times they're not. So you're taking this medically fragile child out. You have to make sure that the parents are not hindering them or making them more sick. For example, you got to make sure that they're washing their hands. They're not touching that patient with dirty hands, because lots of times most of these parents don't understand or don't get it, because you got to realize they were taken out of that house for a reason. So with these doctor visits and these parent visits, one thing that happens with medically fragile children, sometimes you have to bring them back to the hospital. Now, if they're in the hospital for more than 4 or 5 days, you don't receive your stipend. So if you're driving down to U of M, for example, because that's the hospital that they're at, you're not getting paid to drive back and forth. So it's one thing that's kind of difficult about that. Another thing we go over about is children in foster care is another sign that I have. So I know these are very difficult to read, but it says, 1 in 3 children in foster care receive behavioral health services. 1 in 15 receive behavioral health services that are medically. So with this, that means that lots of times when children are being reunited with their parents in foster care, it means that they're going to come back, they're going to have a lot of behavioral issues that you have to deal with. Now, dealing with this means that they're going to come back, they're going to hit, they're going to scream, they're going to yell, they're going to bite, they're going to do all this stuff that you need to deal with. Because most of these children, you're the house that they know. So when you're taking them and you're sending them back home, they don't understand this. So with all this, it's kind of difficult, and it's another reason that a lot of foster care people have a hard time dealing with it. So also with foster care, they have a 2-week window. So if they want to give their notice that this child that's medically fragile is having a hard time, you're dealing with it and taking care of it, they have a 2-week window, meaning that they alert the agency or DHS, state of Michigan, Children's Foster, any of the organizations that they work for, and they have 2 weeks to get that child out of your house. After that, foster parents can do one or two things. They can drop it off at the agency, or they can try to work something out with the agency, but that's their 2 weeks notice. So those are the 3 bullet points that I've gone over with foster care: the daily reimbursements, the medically fragile, and doctor visits and parent visits. I hope this was a little information that you understood about foster care. It's very difficult. It's something that you have to have your heart in. I commend a lot of foster parents that are out there that are doing wonderful work with foster care children, because it's very difficult to raise those children. So thank you.